Hello, I'm Tess Kinning, President and CEO of Bi-State Primary Care Association. It is my privilege to welcome you to our 2026 Bi-State Awards ceremony, an especially meaningful gathering as we celebrate 40 years of Bi-State's commitment to strengthening primary care across Vermont and New Hampshire. Today, we honor 10 remarkable individuals nominated by their peers and unanimously selected by the Bi-State's Board of Directors, whose service reflects the very best of our mission. As we pause together, we celebrate the people who make this work real, those who show up every day, day after day, year after year, with compassion, determination, and an unwavering commitment to their communities. With deep gratitude, we are honored to introduce the 10 award recipients this year. Bi-State Primary Care Association is very proud to honor Steve Carey, founder and chairman of Potomac Strategic Development, as the recipient of the joint Vermont-New Hampshire Chair Award. As a government affairs strategist and government relations partner for Bi-State and primary care associations across the country, and formerly chief strategy officer at the National Association of Community Health Centers, Steve has played an essential key role in keeping federal policy, regulation, and funding for the health centers and workforce priorities for Congress. His earlier service in both the House and the Senate, including roles with Budget, Labor, Health, and Human Services, Appropriations, and the Health, Education, Labor, and Pensions Committee, gives him a rare depth of insight into federal appropriations and health policy. That expertise strengthens national efforts around funding, workforce, Medicare, Medicaid, and the 340B program. Steve founded Potomac Strategic Development in 2007, providing bipartisan advocacy and government relations, and his career is grounded in the discipline, attention to detail, and service he developed during his years in the United States Marine Corps. Having worked closely with Steve over these many years, we can attest to his character, work ethic, his moral compass, and his unwavering commitment to community health centers as he continues to shape federal policy in ways that strengthen care for patients and communities across Vermont, New Hampshire, and the nation. Congratulations, Steve.
I cannot thank you enough for this award, and one that I accept with profound gratitude. You know, I came to Washington, D.C. in 1991 to serve and to change the world. And I soon realized as a lowly legislative assistant that my ability was quite limited. But fast forward to 2000 when I first started working for health centers, and fast forward further to the present. Now we are all collectively caring for 33 million patients across the country. I am now aware that I can, in fact, change the world, 33 million of them, but it's through you. And so with that, I would like to actually dedicate my award to you, because to me, you are the heroes. While I was in the Marine Corps and I wore a uniform, I realized through your efforts that you do not have to wear a uniform to be a hero. You know, you're the ones that have to find the budget. You have to find the providers. You have to find the solutions to help people who you will never meet, whose names you'll never know. But in doing so, you're caring for communities. You're caring for families. You're helping lower the cost of healthcare overall across the country. And so with that, I thank you. It gives me great pleasure to serve you. I cannot go further without acknowledging a great friend and a professional mentor, and that's in Tess. And so I thank her and her team. So with that, thank you.
Today, we are proud to recognize Meg Burmester, Executive Director of the Northeast Kingdom Council on Aging and a dedicated member of Little River's Board of Directors, as the recipient of the Vermont Community Service Award. In her leadership roles at the Council on Aging and as Vice President of the Vermont Association of Area Agencies on Aging, she has championed programs that help older Vermonters live with dignity and independence. Nationally, she brings the voices of rural elders to the forefront through her service on the U.S. Aging Board of Directors. Since 2009, Meg has served on Little River's Healthcare Board of Directors, including as board chair. guiding the organization through periods of growth and change. In her hometown of East Corinth, she is a quiet but powerful presence through the East Corinth Congregational Church, the Women's Fellowship, and the Thanksgiving Baskets program. As she approaches retirement, this recognition honors her decades-long legacy of compassionate services across Orange, Caledonia, Essex, and Orleans counties.
It's an honor to receive this award. When I moved to Vermont, I was delighted to have care so close to home. Little Rivers was a newly formed entity and brought together several health centers that understood an effort to continue in today's world, joining forces was critical. Within a few years, I had a friend who invited me to join the board, and somehow that has translated to 17 years of board membership, with 8 of those being the board chair. What's kept me committed to this simple idea is that care in our communities is essential to the well-being of all of us in our communities. Rural living is not for the faint of heart, and having access to quality care is critical. The staff of Little Rivers at every level continues to inspire me in this role.
We are proud to recognize Audrey Ashton Savage, longtime Lamprey Healthcare board member, as this year's winner of the New Hampshire Community Service Award. Audrey joined the Lamprey board in 1990 and has twice served as board president, bringing steady leadership and a deep commitment to community health. Audrey is generous with both her time and her expertise. As a member of the University of New Hampshire faculty, she regularly creates opportunities to connect students and colleagues with Lamprey's work, strengthening their reach and impact. Her decades of service have helped shape Lamprey into who they are today, an organization grounded in access, equity, and community partnership. Today, we recognize Audrey for her extraordinary commitment and lifelong service.
Thank you so much for this recognition. I'm truly honored to receive this award, but I want to say right away that the work we celebrate today is never done by just one person. Serving on the Lamprey Healthcare Board has been a privilege. What continues to inspire me is the organization's unwavering commitment to its mission. As a board member, I've had the opportunity to see firsthand the dedication of Lamprey's staff, providers, and leadership. Every day, they work to ensure that patients feel welcomed, respected, and supported. Their compassion and professionalism make a real difference in people's lives, and it's an honor to support that work in even a small way. I'm also grateful to my fellow board members who give their time and thoughtful leadership to help guide this organization, and to the Lamprey team whose passion makes our mission a reality. Most of all, I'm proud to be part of an organization that strengthens the health of our communities and expands access to care for those who might otherwise go without it. Thank you again for this honor and for the opportunity to be part of Lamprey Healthcare's important work.
It is my honor to celebrate Heidi Zhang, Northern County Healthcare's Population Health Manager, as the recipient of the Vermont Hunt Blair Leadership Award. Heidi leads NCHC's community health team with exceptional energy and compassion, driving initiatives that support some of the region's most vulnerable neighbors, including programs that address homelessness, food insecurity, and improve screenings for social determinants of health. Heidi exemplifies Hunt Blair's spirit through her deep commitment to community health and her instinct to turn empathy into action. Her passion, focus, and unwavering dedication to community well-being make her a truly deserving fit for this award. Congratulations, Heidi.
I am deeply honored to be recognized by Bi-State and the Board of Directors for the Hunt Blair Leadership Award. I came into this organization at a personal time in my life, just coming off from maternity leave with my second daughter, while also caring for my dad during his treatment for laryngeal cancer. He was a patient at Northern County's Healthcare, and I got to see firsthand the level of care and compassion his team gave him. That really stayed with me, and it showed me what this work looks like when it's done right, and how much it matters. It also made me realize I had stepped into something bigger than just a job. It was actually through the Bi-State Leadership Series in 2022 that I really started to understand the history and purpose of community health centers, and that's when it all came together for me. Seeing the impact of this work and the intention behind it, I realized this is exactly where I'm meant to be. This is more than just healthcare. It's about people, connection, and the responsibility we have to care for our communities in meaningful ways. That's what shapes how I think about leadership. Not having all the answers, but listening, supporting each other, and figuring things out together, even when it's messy. Some days are hard, but being part of the Community Health Center network means that we don't carry that alone. This recognition reflects the people that I work with every day. I'm proud to be part of this team and proud of the work we're doing together. Thank you so much.
Megan McCormick stands out as a leader whose work exemplifies patient-centered care. It is my honor to recognize Megan as this year's joint recipient of the Vermont Hunt Blair Leadership Award. Serving as Vice President of Clinical Services at Gifford Healthcare, she has built her career around addressing the root causes of health challenges before they escalate. Across her career, Megan has been a leader in reducing avoidable emergency department and hospital use through value-based care models. She approaches care delivery with a systems-level lens, ensuring that medical care is integrated with the psychosocial supports patients need to thrive. Her work consistently highlights the social factors that influence health and the importance of coordinated community-based care for high-need populations. Since moving to Vermont, Megan has continued to advance this population health approach at Gifford. Her leadership strengthens primary care across the region, and her impact is felt in every community Gifford serves.
I'm incredibly honored to be recognized by the Bi-State Primary Care Association, and especially to be nominated by my peers. This recognition speaks to a collective effort. I have been so impressed with the team here at Gifford. Everything we've accomplished together around improving access to care and building the team has been a result of people showing up with an open mind and a willingness to try something different. We all know how impactful primary care can be, but it only works when patients can be seen at the right time, and when primary care providers and their teams are supported in ways that make this challenging work sustainable. I'm so grateful to be able to be a part of that work, and especially to do so here in Vermont. So thank you for this recognition. It truly speaks to the strength of the entire team here at Gifford.
For more than 35 years, Dr. Elizabeth Keene has devoted her career to caring for children and supporting the communities she serves. Dr. Keene has long been recognized as a compassionate and dedicated leader in community health. When Manchester Community Health Center and Child Health Services merged to form Amisteg Health in 2019, her leadership played a vital role in maintaining continuity of care for many families who rely on community health services in the Manchester area. Working alongside with Dr. Keene has been both professionally rewarding and personally inspiring. Her clinical expertise, empathy, and steadfast commitment have made a lasting impact. Today, we proudly honor her extraordinary commitment and lifelong service with the Outstanding Clinician Award.
I'm extremely honored to receive this award from Bi-State Primary Care Association. As a primary care pediatrician for the past 35 years, I have had the privilege of caring for children and families from all over the world in New Hampshire's most diverse city, Manchester. Manchester is a refugee resettlement city, and there are more than 70 languages spoken in our community. From these immigrant and refugee families, I have learned the incredible resilience of the human spirit. These families need our support and advocacy now more than ever. We must treat all the children of the world as our own if we are to heal this planet. I'm proud to be part of an organization that supports and embraces this important mission. I'm deeply grateful to my extraordinary clinical team and my wonderful family, without whose support I could not do this important work. Thank you again for this award.
This year, Jana Thompson, APRN, pediatric nurse practitioner and pediatric primary care mental health specialist at Lamprey Healthcare, is the joint recipient of the New Hampshire Outstanding Clinician Award. Jana provides comprehensive pediatric primary care while addressing complex mental health needs with empathy, clarity, and evidence-based practice. Jana is also a key provider in Lamprey's Teen Clinic, offering confidential, youth-centered sexual and reproductive health services. Her ability to build trust with adolescents and support their autonomy has expanded access and improved outcomes for teens. Jana also delivers trauma-informed, consistent care to youth from Nashua Children's Home, ensuring they receive stability, advocacy, and compassion that they deserve. Jana's work strengthens the health and well-being of young people across the region.
Thank you so much for this credible honor. Since entering the healthcare field in the 90s as an LNA and then a medical assistant, my focus was always pediatrics. It was after I started providing medical care in an FQHC that I realized the great need for mental health for children and went on to become board certified in pediatric mental health, which has allowed me to provide integrative care to all of my patients. The recognition is not mine alone. The leadership at Lamprey is supportive and committed to the mission. I'm lucky enough to work with an amazing team of nurses, medical assistants, social workers, interpreters, and community health workers who show up every day with energy, compassion, and determination. Most importantly, I want to thank my patients. You've trusted me with your stories, your struggles, and your care. You've taught me lessons that no textbook ever could about strength, courage, and humanity. Finally, to my family and loved ones, thank you for your unwavering support, your patience, and your understanding of the long hours and emotional weight that comes with this work.
This year's Vermont Outstanding Clinician Award goes to Dr. Barbara Lazar, who, since joining Little Rivers in the summer of 2024, has reshaped how primary care is delivered across the organization. Dr. Lazar developed and now leads the Health at Home program, which brings primary care directly to homebound seniors who face profound mobility and transportation challenges. Dr. Lazar also created healthy aging work groups that provide transportation and on-site group services at Little Rivers clinics. This addresses both medical needs and the deep social isolation that many older adults experience. Patients who had lost hope are now engaged, connected, and receiving consistent, compassionate care because of Dr. Lazar's vision for leadership and commitment to rural elders. Dr. Lazar's work is reshaping what accessible primary care looks like across our region, and our communities are stronger because of her.
I'm deeply honored to receive this award, and I wanted to thank Andy Barter and Simone Lesection for their leadership at Little Rivers. I decided to become a doctor more than 35 years ago when I was working as an aide in a nursing home with my mom, who was also a geriatric nurse. I learned quickly in that setting the value of teamwork. I also learned in that setting the value of thoughtful observation and careful listening. Together with Casey Couric and Sasha Emerson, we've been able to create a home-based primary care team at Little Rivers. Over the last year and a half, we've been able to serve a group of people with very complex needs. None of our patients are going to have a perfect A1C or perfect blood pressure, but they share their goals with us. They help us see what's important to them. And so far, so good. We've been very lucky to get to do this together, and I look forward to working with Sasha and Casey in the years ahead. Also very grateful to the rest of the Little Rivers team. Thank you so much again for the honor of this award, and looking forward to serving our patients for many years ahead.
Today, Bi-State proudly presents the inaugural 2026 Legacy Award, established as part of our 40th anniversary to honor individuals whose impact on primary care in New Hampshire and Vermont has endured across generations. It is my privilege to recognize David Reynolds and Jeannie Ryer as the first Legacy Award recipients, whose vision and leadership fundamentally shaped the organization we are today. At a time of significant change in healthcare, David and Jeannie came together with a shared conviction that strong, accessible primary care is essential to healthy communities. Their determination to support providers, advocate for patients, and build a unified voice for primary care laid the foundation for Bi-State's creation. As founders, they built more than an organization. They established a durable framework for collaboration, education, and advocacy that guided 4 decades of progress. Their work elevated primary care as the cornerstone of community health and ensured that providers across both states had the partnership and policy leadership needed to serve patients well. Congratulations, David and Jeannie, on a much-deserved award.
I am honored and proud to accept this award. I do feel, however, that I deserve only half of the award. The other half belongs to Ann Peters, who 40 years ago founded Bi-State with me. I miss her. I am in awe that from such modest beginnings, Bi-State has become such a potent force for the care for the underserved. So I thank you for this award and for the legacy that makes me so proud.
Thank you all for this wonderful recognition. I'm really, really honored. The honor, though, really goes to all of you. Collectively and as individual centers, you have become a positive force in healthcare, leading the way through health reform and the pandemic, and always putting patients first. I could not be prouder of all you've accomplished in 40 years, and I'm proud, very proud, to be associated with Bi-State.
In closing, the heartfelt statements from our awardees were powerful reflections on the amazing contributions they have made. We are very proud of our awardees and grateful you could join us for this event to commemorate their unique contributions. Their work strengthens the health and quality of life of countless Vermonters and Granite Staters. As we celebrate 40th anniversary milestone, we continue to celebrate the people who make progress possible, our partners, our members, our sponsors, and all of you who work every day to expand access to high-quality, affordable primary care. Thank you for being here today and for lifting up the remarkable individuals who keep our mission alive. This celebration reminds us of how far we've come in 40 years and how much we can accomplish together in the years ahead.